I think so.
I had the Zoom because you said use the icon, no? And you just have to share screen.
Sure.
Or use camera.
I did.
Okay.
Is it starting?
Okay.
Hi, good morning. It's Dr. Adelsheimer. We're going to be starting the webinar in a few minutes. I just wanted to give folks a couple minutes to log on. Hope everybody is doing well out there today. It's another cold, frigid day here in Pittsburgh. We've got a lot of snow this week, and hopefully people are staying safe, not injuring themselves. Tend to see a lot of low back injuries this time of year. But that's what shoveling snow on cold days will do. So if you must, be careful. And again, want to welcome everybody today. And like I said, we're going to be starting in a few minutes. I'll be sharing my screen in a second. Just trying to. I'll be right back and we'll get started. Okay, I'm going to go ahead and get started, and if others log on and join in, that would be great. You know, if not, we're going to go ahead and get started with everyone who's here now. I am going to be sharing my screen, and we'll be going through a slide presentation. And I just wanted to let everybody know that I will have as much time as needed at the end to answer everybody's questions. So please save your questions for the end, and just gonna pull up my PowerPoint. Okay. First. Okay, so we're gonna get started. Anyways, first and again, I want to welcome everybody to today's webinar. Thank you for joining me on this cold wintry day. It's good that we're having this as a webinar so everybody can stay safe and warm in their homes. And today's topic is going to be how to avoid surgery, reducing pain. And we're going to be talking about all of the non-operative procedures that we have here at Regenexx Pittsburgh. So first, I want to introduce myself. For those who have not met me yet, I'm Dr. Mark Adelsheimer. I'm a native of Pittsburgh. I did my undergraduate education at Duke University. I went to medical school at the Medical College of Pennsylvania. I then did my fellowship in Boston at Tufts University, where I did my internship and residency programs and my training in physical medicine and rehabilitation. I then moved to Pittsburgh in 1996, and I've been practicing here in Pittsburgh for 25 years. In my spare time, I like to play some golf. And these are my two partners, Dr. Lieber and Dr. Sally. Dr. Lieber and I, Dr. Lieber is the one in the middle, We've been together for the 25 years since I moved to Pittsburgh. All three of us are Pittsburgh natives. Dr. Sally joined our practice a little over 5 years ago. All three of us are board certified in physical medicine and rehabilitation with advanced training in sports medicine and pain medicine. We have 5 physician locations in the Pittsburgh area, with our main practice being what we call our Pittsburgh location, which is actually in Fox Chapel. And that's where we do most of the procedures that I'll be talking about today, because that's where we have our lab and we do all the Regenexx procedures. But we also have other offices where we are available to evaluate patients in Monroeville, Sewickley, Bridgeville, and Washington, Pennsylvania. So again, we're a 3-physician practice. We don't have any physician extenders. We have about 10 to 12 office staff who work with us at our different locations. First and foremost, we are a COVID safe zone. We have been practicing CDC protocols since the get-go. Everyone in our office has had the COVID vaccine, and everybody can feel very safe to come to our practice. We have not had one occurrence of COVID through our practice. And again, we will be screening all of our patients. Everybody is wearing masks. So I think it's really important to note that you should feel very safe in coming to our practice. And again, mentioning the fact that we've all been vaccinated with the Pfizer or Moderna vaccine. So why are you here today? So we're going to talk about non-operative options. We're looking for additional options for pain. How do we avoid downtime? How do we avoid surgery? What if I'm not a surgical candidate? What if I don't want to rely on medications? What if I don't want to just learn to live with it? I'm not ready to slow down, and I really want to, more importantly, improve the quality of my life. These may be things why people are here, and these are things that we see every day in our practice. Really, the goal is to improve the quality of your life. So whether that means going out and playing some golf or other sports, being more aggressive when it comes to competitive sports, or just enjoying free time with family and friends, and again, having a more active quality of life. So this is a brief overview of today's agenda. I'm first going to talk about Regenexx, which is the name of our practice and the company that we're affiliated with, who we do all of our regenerative procedures from. I'm going to talk about different options that Regenexx provides. We're going to talk about interventional orthopedics and that new concept of how we approach things differently from an orthopedic standpoint. We're going to talk about the differences that Regenexx has to offer versus other providers who may be providing similar type of procedures. We're also going to talk about who this is for and some of the results that we see. So let's first talk about Regenexx. Regenexx is a company based out of Colorado. It started in 2005, and it was the first clinic on earth that began treating orthopedic conditions using precise stem cell injections. Dr. Lieber and I met Dr. Centeno and Schultz actually before 2005 when they first started talking about these procedures, and we were actually one of their original extended networks. So they started in Colorado. They became too busy and too big, and they shortly branched out to different parts of the country. We've been part of the Regenexx network since 2012. And again, we were one of the first clinics to join the network. Now there's 65 providers around the country. Everyone is an MD or DO. We don't have any PAs or nurse practitioners or chiropractors in the network. And everyone is trained to perform high quality procedures in the same way. And that includes whether we're doing prolotherapy, PRP, or stem cells. What that means is that we're not just taking a weekend course. We've spent hours upon hours of training to learn how to do these procedures. I personally go out to Colorado at least twice a year for additional training. We have annual meetings. We have daily interactions with our LinkedIn network to talk about various cases. And really, it's a privilege to be part of the Regenexx network. So Regenexx is not a product, but it's a family of medical procedures that, again, define a new medical specialty, and that's interventional orthopedics. And it's not an add-on to an existing surgical procedure, but again, a new way of approaching orthopedics problems. So again, I've used this term a few times already today. That's interventional orthopedics. So what's the goal of interventional orthopedics and what is it all about? You know, our goal is to use less invasive procedures to avoid more invasive surgery. So again, interventional orthopedics is not surgery. This is injection procedures. So we're not going to talk about surgical options. This is how to avoid surgery and still have good outcomes. Because the body has a great ability to heal itself. Surgical orthopedics will not be the dominant form of care as we move forward. There's been a lot of research specifically lately on meniscal surgeries, and the research shows that this is not only not necessary, it actually causes harm. Removing the meniscus or a piece of the meniscus significantly increases the risk of developing early arthritis in the knee where it was removed. So let's stop cutting things out and let's instead allow the body to heal. Let's inject biological agents that can help tissues to heal. Cutting things out does not lead to healing. It actually leads to more damage. So orthopedics is changing, and it's been changing rapidly over the 25 years that I've been in practice. In 2000, almost everything was done surgically. By 2015, injections had taken over a part of this, but the future is really going to look more like this, where about 1/3 of procedures are done surgically and 2/3, if not more, are done interventionally or with injections. We're already seeing this change. Again, we're in 2021 now, so we're further along this curve than what is shown here in 2015. And it's really important if you're going to practice interventional orthopedics that you know where and how to place your needles. So there's 3 different ways of basically placing needles in people. One is what 50% of doctors do, and that's blind, meaning they just stick a needle in and hope it hits the right spot. They don't have any training and don't know how to do image-guided procedures. Really not a good idea. When people tell me all the time that their injection didn't help, my first question is, well, did the doctor even know where to put the needle or how to put the needle in? The next step up the ladder is more of a shotgun approach, and that's where they may have a little bit of guidance, they may have a little bit of training, and about 45% of physicians fall into this category, but they really aren't experts in the field. So yes, a little better, accuracy might be a little higher, but not talking about highly trained experts that know exactly where to place their needles. And for precision guiding, which is more the rifle approach, you can make 100% sure that your needle's in the right location. This requires really months and years of advanced training to get to that level. In fluoroscopically guided procedures, that means using an X-ray or an ultrasound guided procedures, which again is not something that you learn over a weekend or just by watching another doctor do this a few times. You either have to do full fellowships in there or spend years of training. And again, being part of the Regenexx networks enables the physicians to have these years of training. So again, every Regenexx doctor is going to be this precise guided because of our advanced training. So with Regenexx, we basically have 3 different treatment types. The first is called Prolotherapy, which I'm not going to spend much time on, but I'll briefly mention. And then we'll talk more about the PRP and platelet procedures, and then most time on stem cells. So prolotherapy, as again, I'm just going to mention that briefly, is actually the grandfather or the founder of regenerative medicine. Prolotherapy has been around for almost 50 years. It's a sugar water-based treatment solution that physicians have been injecting for long periods of time that help to promote healing. It doesn't require any blood or bone marrow from a patient. And it does help to tighten, especially lax ligaments. We still use prolotherapy in our practice, and you'll see where we use it specifically as part of our stem cell procedure. But for the most part, PRP and stem cells have replaced traditional prolotherapy because it works a lot. The other products work a lot better. So if you're able to use the actual biologic cells, it's going to work better than something you have on our shelf. And again, prolotherapy is something we have on our shelf. So what cells do we use? The first cell we use is a platelet. Platelet is a blood cell. So very easy to gather these. All you have to do is come in and we draw some blood. Platelets contain healing growth factors, and that's one of the most important reasons why we use platelets. They help to speed up the repair of tissues. They also contain a substance called serotonin that helps to calm down pain. And they also work by attracting stem cells and activating stem cells to work better. So platelets are the healing cells in the blood, and we use platelets very frequently as a standalone treatment and also as part of our stem cell treatment. So for standalone treatments, there's really two ways that we're using platelets. The first is what called PRP, or platelet-rich plasma. Here at Regenexx, we call it SCP, which really just stands for super concentrated platelets, but it's the same thing. It's still platelet-rich plasma. And PRP has been around for about 10 to 15 years. There's been a lot of great research on the efficacy of PRP throughout the body. It's very common in the sports medicine community because it works really well to heal most sports injuries, which are generally tendon, ligament, cartilage type injuries. So somebody who might have tendonitis, say rotator cuff tendonitis, or golfer's elbow, or tennis elbow, or Achilles tendonitis, or have a more minor injury to a cartilage like a meniscal tear, or have minor arthritis in a joint, or have some laxity of their ligaments, PRP is a great form of a standalone treatment to help heal those problems. So again, most sports injuries, when they're not more severe, most overuse injuries, even things like plantar fasciitis and other foot and ankle problems, respond really well to PRP. So again, most more minor orthopedic problems, PRP by itself is the way to go. So again, we would evaluate you and see if PRP would be the correct treatment solution for you, or if we need to go on to more advanced treatments. Platelet lysate is also using platelets, but we're using them in a slightly different fashion. When we lyse the platelets, what that means is we actually freeze them so they release all of their healing enzymes. That happens immediately, and it works best if you're treating injured nerves. So for the main place that we will use platelet lysate is when we're doing our epidural injections in the spine. In the past, we used to do epidural steroid injections on a regular basis, and we have replaced almost all of the epidural steroid injections with platelet lysate. And I'll show you more about that a little later in the discussion. We also use platelet lysate for other nerve entrapment, such as carpal tunnel syndrome, tarsal tunnel syndrome, or any place that a nerve might be entrapped, because the growth factors are immediately available and work very well on injured nerves. Now, most practices, especially every orthopedic practice nowadays, does have PRP. However, the Regenexx PRP is a significantly better product. Here is a picture of standard PRP on the left versus Regenexx SCP on the right. And clearly, the main difference that you can see is that the standard PRP is red because there is still a lot of red blood cells in there. They don't have the technology that we do to help remove all of those cells. They are buying cheaper bedside machines that don't work nearly as well. How do I know that? Because we used to have one of those machines before we became a Regenexx provider. Again, we've been doing PRP for about 15 years, but doing it with Regenexx for the past 8 years. And as a result, our outcomes are significantly better because we are no longer putting in a bloody PRP product. We are putting in a super concentrated platelet product, which again works better. And that's the main benefit of that. Okay, so now we're going to shift gears and talk about stem cells. And, we've been doing stem cell treatment also since 2012 here in our practice. First, let's talk about stem cells before we talk about what's involved with a stem cell procedure. So a stem cell, and again, we're using adult autologous, meaning your own stem cells, is an undifferentiated cell that's held in reserve until replacement or repair is needed. Undifferentiated means it can turn into many different cell types. So the same stem cell, if needed to turn into something to repair bone, will turn into a cell called an osteoblast, which will then make bone. The same cell, if it needs to repair cartilage, will turn into a chondroblast, which will then create cartilage. So that's the cool part about using stem cells, is the same cell can replicate into multiple different types of stems, into different cell types. So meaning that the same cell can repair almost everything in the orthopedic lineage, which includes muscle, ligament, tendon, bone, cartilage. And that's where we use our stem cell procedures. So stem cells orchestrate a repair response. They not only turn into cells that create new cells, but they also repair the damage that's already there. And I'm going to show you a lot of examples of where stem cells have really turned the tide in terms of repairing a damaged area. One thing that you don't notice when you're using stem cells is the change of the biochemistry inside a joint, and that's where stem cells are orchestrating their repair response. It's also important to know that stem cells are self-renewal. So if we do a stem cell procedure and take 1 billion of your stem cells, your body will regenerate all of those stem cells within 6 weeks. So, you don't have to worry about, oh my God, if I have a stem cell procedure, what's going to happen? I'm not going to have any more stem cells. That's 100% untrue. The body regenerates those all the time. Just like if you were to give blood, your body regenerates blood. Stem cells have the same self-renewal. They can also help to provide new blood supplies where they're injected. So again, here at Regenexx Pittsburgh, we are discussing adult, not embryonic stem cells. I mean, we're not getting these from a pregnant woman, from birth product. These are from you. Autologous means that they are your cells. These are mesenchymal stem cells. Mesenchymal stem cells come either from bone marrow or adipose. And I'll explain a little bit later why we primarily use bone marrow. We have used adipose, but the main reason why we don't is use adipose much at all is because it doesn't work nearly as well. So before I get into talking about the different areas of the body that we treat with stem cells, I want to let everybody know what's involved with a stem cell procedure. This is actually a 3-step process. And I always tell people the analogy is the same as if you were planting seeds in your garden. So before we even do the first step of the 3-step process, the first step is actually to make an appointment. Come in and see myself, Dr. Lieber or Dr. Sally in one of our 5 locations. We will do a comprehensive history and physical examination, and we will discuss your different options with you. If you decide, yes, I want to go ahead and do a stem cell procedure, if that's what's recommended, again, it is a 3-step process analogous to planting seeds in your garden. The first step is done before your stem cells, and we call it our pre-injection. That's what you see as appointment 1, and that's done with Prolotherapy, or the grandfather of regenerative medicine. Why? Why do we put prolotherapy in a joint before we put stem cells in? Is because prolotherapy effectively tills the soil or gets things ripe and rich before you put the stem cells in. So if you were to, for instance, treat a knee and you put the prolotherapy in a few days beforehand, it's going to bring a lot of blood supply to the surfaces and make that knee joint ripe and rich. So when we put the stem cells in a few days later, they will stick better and work better. So on appointment 1, you come in, we don't need to draw any blood or bone marrow from you. This is, again, a solution we have on our shelf. We will inject this solution into your joint that we're treating under guidance. And again, this is really important to stress that every needle we stick in you during your entire experience with us is done guided, meaning we will be using ultrasound or X-ray. We will never blindly sticking needles into people. As I showed you earlier, we use precision guided techniques. So we will put the prolotherapy solution in, and I'm going to stick with the knee as the example, into your knee. There's no downtime afterwards. You can work out, you can exercise. Most people even feel a little bit better between appointment 1 and appointment 2 because prolotherapy does have some anesthetic component to it. So anyways, appointment 2 is step 2, and that's when we are planting the seeds or planting your stem cells. And that's 2 parts. The first part is we need to get your stem cells. And again, as I mentioned, we get these from bone marrow. That's what the picture is showing on the back. The bone we utilize is your pelvic bone. Your pelvic bone is the largest bone in your body. It's very easy to get a needle onto that bone and very easy to get a needle into that bone. When I discuss this part of the procedure with my patients, this is a part where most people have some concern and anxiety. And I tell everybody the same thing, is that this is really not a big deal to do. I've personally done well over 1,000 of these. Our practice has done over 3,000. It is not a painful experience. Basically, what you will feel is a pinch and a burn when we numb your skin. You may feel a little bit of burning when we numb the bone underneath, but once that bone is numb, you will not feel the needle going into the bone. The needle needs to go into the bone because that's where bone marrow lies. We then will pull the bone marrow out from inside the bone, and then we take that bone marrow to our lab, which is right here in our Fox Chapel office. It takes my lab technician about an hour and a half or so to process your bone marrow, because bone marrow is about 95% other cells and only about 5% stem cells. We only want the 5%. During that hour and a half, we will give you a gift certificate for breakfast or lunch, and you can leave and go get something to eat. But we do need you back the same day, and that's why it's your bigger day. The reason we need you back the same day is twofold. Number 1 is your stem cells are alive, and we want to put them right back in you while they're alive. Number 2, if we kept them overnight, it would no longer be FDA approved. And again, everything we do is an FDA approved procedure. After we place the stem cells, and again, so the second part of your day is putting the stem cells into where we're treating. So if we're treating your knee, your shoulder, your hip, or another part of your body, we will have you most likely under X-ray, probably ultrasound as well, to make sure our needles are treating the exact problems that you're there for us to treat. So if it's osteoarthritis, we're going to be on the cartilage. If it's an ACL tear, we're going to be on the ligament. If it's a meniscus, we'll be on the meniscus. And again, our image guidance will make sure that we are in the correct location. So then you go home, and then you usually come back 2 days later for your third part of your stem cell procedure, and that's done with PRP or platelets. As I mentioned earlier, platelets act like a stimulant to stem cells, or they fertilize them, so they make them work better. So again, the analogy of tilling the soil with prolotherapy, planting the seeds with the stem cell procedure, and then fertilizing the seeds with the platelets afterwards. And that's why we do a 3-step process. This is one of the things that separates Regenexx from all other clinics who are doing stem cell work. And again, this has been studied and researched and has led to by far the best outcomes possible for our patients. So first question is it safe? And this is an absolutely very safe procedure, especially if you're comparing this to surgery. There is little to no risk with this procedure. Again, anytime you stick a needle in, there's always a risk for infection or bleeding. We've never had an infection. We've never had a bleeding problem. We've never had other more serious problems like death, heart attack, stroke, cancer, etc. We did produce a study on almost 3,000 patients that showed 0 complications. Surgery can absolutely not promise you the same thing. Surgery can lead to significant complications, including all of those serious problems that I just mentioned. So let's move on to talking about where, and I'm just going to stick to the kind of main 3 areas or main 4 areas of the body that we treat. But again, we do treat other areas as well. I'm going to start with the knee, since that's the most common area that we use for our stem cells. And there's 2 reasons for that. Number 1, it's probably the most common problem out there. But number 2 is that knees do really well. They are home runs. Even people who have end-stage bone-on-bone, I need a knee replacement tomorrow, arthritis, can undergo a stem cell procedure. They are otherwise a good candidate and expect to have a good outcome. So again, osteoarthritis of the knee is the number 1 condition we treat. It can be very severe, meaning it can be bone on bone. It could, you can have little to no joint space left. We've done these on a lot of elderly patients, including a 98-year-old gentleman in our practice. We've done several patients in their 80s and a few in their 90s. So age is not a factor. Body mass index is also not a factor. Some people are too obese to undergo a knee replacement. They've come in and we've done stem cell procedures and they've had very good outcomes. On average, people who have end-stage bone-on-bone arthritis are seeing about a 2/3 improvement, meaning a 66, 67% improvement down the road, which is very significant. Other areas of the knee that we treat are, as I mentioned earlier, meniscal problems. Meniscal problems can be cured with stem cells or possibly just PRP. If you have just a meniscal tear and a otherwise normal knee, we're going to be talking about a PRP procedure, not a stem cell procedure. However, most people with meniscal problems also have arthritis of the knee. So again, that's why we treat both of those at the same time. We can also treat ACL or anterior cruciate ligament tears as long as the tear is up to 1 centimeter and there's still an intact sheath, which we will be able to tell by looking at your MRI. And the outcomes are very good for those treatments. Here are just a couple of examples of a few patients that we've treated. The first is someone with knee osteoarthritis, very typical for our practice. This was Pam, a 58-year-old aerobic instructor. She had 4 years of severe knee pain. She had grade 4 chondrosis, which is the worst grade you can get. She had, and that means grade 4 cartilage loss, that she was basically bone on bone. Her pain was a 6 or 8 out of 10, and most importantly, she wasn't working or able to do the things that she wanted to do in life. She received a stem cell treatment to her knee shortly after looking at that first MRI. Within 3 months, her pain was down to a 1 out of 10. She felt 85 to 90% better. And her follow-up MRI about 9 months later did show that she had regrown some cartilage. And I emphasize the word some because this isn't going to regrow all of the cartilage that you once had. However, it's going to regrow some, and more importantly, it's going to make your knee feel better and function better. And that's the most important thing. And it does that by healing the joint itself. As I mentioned, it changes the biochemistry. It produces healthy enzymes as opposed to toxic enzymes that help to destroy the knee. This is an example of someone with a torn ACL, which is right here on the left. This was pre and post stem cell treatment. You can appreciate how that nice black line has returned. That's the intact ACL. Here's the PCL. You can see was intact already, but on this image, the ACL was not. And this was 6 months after a stem cell treatment. Moving on to the shoulder, this is the second most common area that we treat. And we can treat rotator cuff tears, even a full thickness rotator cuff tear, as long as it is less than 1.5 centimeter. Partial thickness tears respond really well. And again, over 80% of our patients will see at least a 50% improvement, if not more. We can also treat labral tears, which are slap lesions. These are very common sports injuries or overuse injuries. And again, over 50% of patients will get more than 80% improvement. We also can treat more minor problems of the shoulder, like biceps tendonitis or rotator cuff tendonitis. Again, those are usually done with PRP and not with stem cells. And finally, with the shoulder, we do treat arthritis, and it does respond very nicely to stem cells. Not quite as robust as the knee, but still responds very nicely. About 50% improvement, if not more, for over 80% of our patients. Here's an MRI example of someone with a torn rotator cuff pre and post stem cell procedure. One can appreciate where that arrow is pointing. There's a lot of fluid in there. There's a tear. After a stem cell, that tendon has now repaired. Moving on to the hip, this is the third most common area that we treat. Hips do well as long as you are a good candidate. And it's very important that you are evaluated appropriately to see if your hip problem would respond well to stem cells, because as different from the knee, people with end-stage bone-on-bone, I need a hip replacement arthritis do not do as well with stem cells as they do in knees. So most favorable outcomes are on younger ages, most favorable if there's not a significant range of motion loss. So if somebody has a severe contracture, or if they're elderly, they may not do as well. And this is why everybody needs to come in for an evaluation first before we would even talk about whether or not you would be a candidate. The second category of hip problems we treat is something called avascular necrosis, and that's when part of the hip bone dies. That can happen from arthritis, that can happen from steroid injections. There's a lot of things that can lead to that. And in those cases, we actually do drill a needle into the bone and place stem cells directly into the bone to help heal that problem. So 73% of Regenexx hip patients have returned to sporting activities and have had very good outcomes as long as they are otherwise a good candidate for a hip procedure. Here's an example of what I was talking about when we drill the needle into the bone. This is where the lesion is at the end of this bone, and we're putting stem cells directly in there. So the last area that we most commonly treat is the spine. And we treat a lot of spinal conditions with regenerative procedures. Most often in the spine, we're using platelets, not stem cells. So we will treat people with irritated nerves or sciatica. That's where we use our platelet lysate procedure. We will treat painful and herniated disc, facet-mediated pain, ligament pain, sacroiliac pain, spinal stenosis, and people that have had prior spine surgeries. And again, we treat the cervical and lumbar spine as well as the thoracic spine. As I mentioned earlier, we have replaced basically almost all of our epidural steroid injections with platelets. The reason being is because of this slide. When you get an epidural steroid injection, that effect is almost gone by 3 months, and by 6 months, it's 100% gone. Whereas an epidural platelet injection will lead to long-term healing, long-term benefit. At 3 months, almost 100% of patients are still having great outcome. And at 6 months, it hasn't dropped off very much at all. So again, the goal of the platelets are to have long-term benefit, not just a quick fix. And that's kind of true for steroid injections wherever you do them in the body. Steroid injections are really just looking for quick fixes. They actually can cause more harm than good in the long run, and they should be avoided if at all possible. So again, as I mentioned earlier, I'm going to talk a little bit about how Regenexx stacks up to other providers who are doing similar work. The different providers out there are either using adipose-derived stem cells, amniotic stem cells, umbilical cord blood, or something called lipogens. When you're talking about amniotic stem cells versus adult stem cells, amniotic stem cells really what they're using is amniotic fluid. And this is basically done by a lot of clinics, especially chiropractic clinics, who have no training in advanced precision guidance, have no understanding of regenerative medicine. They've been sold a bill of goods from companies that says that you can put these in people. There are no stem cells in the amniotic fluid. It's mostly just baby urine. There's no research to prove that this works, as opposed to stem cells that we talked about before that actually do work and make a huge difference. Again, amniotic stem cell procedures are usually done in a chiropractor's office. They do not use guidance. They have no training in how to do these guided. They're often done by a PA or nurse, as opposed to our office where it's only physicians doing these procedures. And they do charge a lot of money for these and have no data to help show that these procedures actually help. As far as fat is concerned and amniotic tissues, the FDA is looking into both of these issues. There have been a lot of FDA regulations on fat. They're now cracking down on amniotic fluid as well. You have to be very careful if you are seeing somebody who may be doing one of these treatments. Fat does not have more stem cells in bone marrow. Fat actually has a lot less stem cells in bone marrow, especially mesenchymal stem cells, which are the ones that help to treat orthopedic problems. So we're able to see about 10 to 20 times more stem cells when using bone marrow as opposed to fat. So there's been a lot of head-to-head research in terms of treatment outcomes on fat versus bone marrow, and this research heavily favors bone marrow. Again, our stem cell procedure can obtain about 20 times the number of stem cells compared to bedside centrifuges. People also, will say, hey, my stem cells are too old. And that's not true. First of all, the stem cells that you have in your body are regenerated constantly throughout your life. So even though you may be 90 years old, your stem cells are not 90 years old. You are not born with all the stem cells you have throughout your entire life. Our data and other data has proven that stem cells taken by elderly adults still perform very well and actually do no better than people who are younger. So what's the downside to all the things that we do? The main downside is insurance doesn't cover the regenerative procedures for the most part. And that includes prolotherapy, PRP, platelet lysate, and stem cells. However, when you do compare the average cost of surgery with the average cost of a regenerative procedure, it's not even comparable. Even out-of-pocket cost to an individual can almost be comparable when you're looking at this. So again, different treatment options that we have different prices. It kind of depends on what we're looking at. And again, we would go over all of this with you before we decided to do any type of procedure. So in conclusion, Regenexx isn't magic pixie dust. It's advanced, precise, safe interventional orthopedics. We've been doing this longer than anyone else. We have more treatment options available than anyone else. We have published more on our online registry, and we spend this money to stack the deck in our favor, meaning that we all the research, all the data that we have collected, we use to help improve our products. So how do I get started? If anything else, the main goal of today's presentation is to say, make an appointment. Anything that may be bothering you is something that we can evaluate here in our practice. So you make an appointment to see myself, Dr. Lieber, or Dr. Sally in one of our 5 locations. We will do a comprehensive history and physical examination, and we will give you an honest opinion as to what your problem is and how, if any, we can help you with your problem. If you have some recent MRIs, that would be great. If you don't, we can order those for you. So please schedule a appointment to see us. Your office visit is covered by your insurance, and we take basically every insurance in the Pittsburgh area. We bill it just as you would to see any specialist. So you don't have to make any type of decision, any type of financial decision by making an office visit. It would be the same as if you were to see any other physician within your network. So again, the next step is to contact the Regenexx call center. Our number is 412-963-6480 and schedule a new patient evaluation. Again, it would be with myself, with Dr. Lieber, Dr. Sally, and we will give you an honest opinion as to what we see as your problem and how our procedures may be of benefit to you if we feel that would be what would help you. So as I mentioned at the beginning, I will spend as much time answering any questions that people may have. I'm going to exit out of the slide presentation and go back to the Zoom talk. And if somebody has any questions, please place these into the chat, and I can answer these. There is a Q&A questions, and people can place these in here at any time. Some questions that have come up before I can kind of start in on is, okay, these stem cell procedures sound great. If this works, how long will it last? And that's a great question because, you know, we do have a lot of data now that's kind of leaning us towards answering these questions. When we first started doing this, my answer was, well, you'll let us know, we'll see. But now we have a lot of data, especially really good 5-year data that show that people have had a stem cell procedure are still doing well 5 years after the stem cell procedure. So we don't know if it's going to last 10 years and beyond, but we do know that people are getting at least 5 years of benefit. We've had very few patients that have needed to have a second procedure done. So this is leading to, again, good long-term benefit. The question came up, said, do the stem cells actually repair cartilage in the knees? And the answer is yes, it does actually help to repair the cartilage in the knee, especially the cartilage that's already there. That's how stem cells work. It makes that cartilage healthy and strong once again. Healthy, strong cartilage will function better and hurt less. And that's what people are looking for. How can I do more? How can I be more active? I like to hike. I like to bike. I like to play tennis, golf, or just be able to go for a walk or go to the mall or go out to dinner. So yes, stem cells do repair damaged tissue, cartilage, ligament, bone. That's how stem cells work, by repairing those damages. Another question is, if I have 2 bad knees, can I do both at the same time? The answer to that is generally no. And the reason for that is because if we were to take half of your stem cells and put them in one knee and half your stem cells and put them in the other knee, each knee would only be getting about a half a treatment. So it's much better to do one knee first, let that heal up, and then 3 to 6 months later, do your other knee. As I mentioned, your body will regenerate all of the stem cells that we take out within 3 months. So for that reason, we don't do 2 knees or 2 hips or 2 shoulders at the same time. Occasionally, we will do a second joint if it's small. For instance, the CMC joint in the thumb, which I'm pointing to right here, which is the most common joint in the hand to have arthritis, or maybe your big toe. We can always spare a few stem cells into one of those smaller joints to help to treat those as well. Are there other questions that I can answer for folks? Again, this presentation is being recorded, and if people want to view the recording and ask us questions later, that would be absolutely fine. I'm not seeing any additional questions being asked at this time. So with that being said, I will conclude today's webinar, and I want to thank everybody for joining me. Again, we are here at Regenexx Pittsburgh to help you with any orthopedic problem that you may have. Please schedule a new patient evaluation, and you will get an honest opinion from myself or Dr. Lieber or Dr. Sally, and we will talk about various treatment options that we may have available to you. We've been doing this now for over 8 years with a lot of success. And again, all of that data is available to you to look at. So again, I want to thank everybody for joining me this morning, and stay warm out there on this cold winter day. And we hope to see you here soon at Regenexx Pittsburgh. Have a great day.